So hi, I'm Greg Fell, I'm the Director of Public Health at Sheffield, and I'm here to introduce the key aspects of this year's annual Director of Public Health report. It will be on the website of Sheffield Council and freely available to all, and I'll spend the next 2 or 3 minutes talking about the key themes. So firstly, and perhaps most worryingly, we've seen over the last year or so the historic improvements in life expectancy have basically ground to a halt, and that's been happening nationally, and it's definitely been happening in Sheffield as well. There are some worrying signs that it's getting worse in some parts of the country. We've not seen that here yet, but we may well do. And what we're beginning to worry a lot about is that the improvements are, like everything else, inequitably spread. So those that are most vulnerable are having a worse deal. Linked to that is the change in healthy life expectancy. This is one of the key measures of health for any city. It's not how long you live, but it's how good your quality of life is. And like life expectancy, we're beginning to see the historic improvements in healthy life expectancy grinds to a halt. And again, this isn't evenly split across the population. It would seem, though the data isn't quite clear on this yet, that those who are most affluent, those who are doing best, aren't faring as badly as those who are doing worse, and that's a real worry. So those are the headline findings, and then I've split the rest of the report into 3 main areas. The first one is around adverse childhood experiences, or adversity in childhood. We all know that's a big issue. We all know that's not good from a whole range of different perspectives. What we've become aware of in the last few years is an increasing evidence base that adversity in childhood has lifelong consequences. It's just not something that affects children. It affects children for the whole of their life course. And what we're seeing is that the more adversity you're exposed to in childhood, 1, the worse your children's outcomes are, but 2, that tracks through into adulthood, both mental health and physical health outcomes in adulthood. And we set out a range of ideas for 1, building a better research base, but 2, building the interventions to address that. The second area is around mental well-being for life. We know that if you have a mental illness, the services that we've got in Sheffield are actually pretty good. There's always room for improvement, but they're pretty good. There's a pretty good and coherent service offer. What concerns me mostly is preventative mental health care, so preventing people becoming mentally ill in the first place, and we don't have as good story to tell as we might do there. There's a combination of the things that drive mental well-being, adversity, deprivation, poverty. Austerity is a factor in that, and we shouldn't run away from that fact. So that's addressing those factors is a combination of better services and services that are more in tune to the real needs of people, but also social policy. What is it that we're doing as a city around poverty and redressing the issues that poverty causes, both now and for the life course? The third area is around multiple morbidity or multiple illnesses. We have a system, a health and social care system, that's really good at providing care for people with single illnesses, and particularly episodic care for people with single illnesses. But the world doesn't look like that. The world looks like many people have multiple illnesses all at once, or multimorbidity as it's commonly called. There's a notion that the ageing population spells certain doom for health and social care. It just isn't true. What may spell certain doom for health and social care is our inability to prevent. That's the thing that we really need to up our game about, and that's one of my key messages. And finally, as ever, we have not yet solved the problem of health inequality. There is still a 25-year gap between best and worst with regard to healthy life expectancy. That's not fair, it's not right, and it's not just. I will say there's no simple, easy, pithy answer to that one. It's an issue that affects the whole of society, therefore the whole of society needs to be involved in the solution.